great show today, starting with something that is really quite important because people say there's nothing more exciting in life than having a baby. But when it comes to labor, is the all-natural watch-and-wait approach the best for mother and baby? Not according to the authors of a new study from the University of South Florida that suggests inducing labor at 39 weeks, that's 1 week before a traditional due date, may reduce complications and may prevent deaths. Dr. Charly Lockwood, the senior author of this study, joins us now via Skype. And Dr. Lockwood, can you tell us a little bit about your findings and why you are saying that induction may be best?
What we found was that if you compared elective induction of labor at 39 weeks to expectant management, where we normally would just follow the woman over the next few weeks and induce her by the 42nd week if she didn't go into labor, we had a dramatic effect on reducing cesarean delivery rates and in reducing fetal death rates, stillbirth rates, neonatal or infant mortality and morbidity, and maternal morbidity.
So were there any acknowledged limitations during this study?
Well, there were. In a way, it's an idealized study because we can assume that the induction of labor was done correctly, that enough time was given, and that there were no other extraneous factors. And bear in mind, we're looking at women who are having their first baby, who've had uncomplicated pregnancies, and who have had their babies are what we call vertex presentation, the head first. And so they're a very uncomplicated population. In the real world, not everybody fits that criteria.
Based on some of the studies that you've done, you think that there may be some benefit to early induction, but obviously other people believe that inducing labor when it's not medically necessary isn't the right way to go. OB-GYN Dr. Russell Clayton contends it's best to let nature take its course. Dr. Clayton, you've been listening to the conversation here. You question the idea of early elective induction. Tell us why.
A woman's cycle, her pregnancy cycle, is 280 days from her last menstrual period, or 40 weeks. By moving that timeline up by 1 week, I think that that's messing around with nature. So I don't think that that's viable for that standpoint.
You may have heard that 37 weeks is technically term, and that is, it's early term though. So between 37 weeks and 39 weeks, as OB-GYNs, we all agree that unless there is a medical indication on mom's side or baby side, that we would rather not deliver babies at that time. If you come in labor, then absolutely fine, we will let you go and you'll have your baby, and most babies do fine, but there is an increased risk of things like respiratory problems during that time frame. So that's why, unless we have a reason, we will not move forward with induction. At 39 weeks, if you're having a repeat C-section, for example, we know that that's an ideal time to go ahead and schedule that because babies do well, and we want to decrease the probability that you're going to have those regular uterine contractions that can lead to a uterine rupture. Now, the question comes in between like the 39 weeks and when you're moving towards 42 weeks, like when is the perfect time to induce these patients? Because we're trying to make sure we're not doing too many C-sections, but we also want to make sure we have a healthy mom and baby. So that's kind of the gray area that we're talking about. At 39 weeks, some doctors will say, okay, we can go ahead and induce you, and they don't care what your cervix is. So meaning your cervix can be closed and your body isn't quite ready, or maybe it can be a little bit open. Now, some doctors will say, well, if your cervix isn't really open, then I don't want to move forward with induction. Or even if your cervix is open at 39 weeks, some doctors will still say, I still want you to just go into labor by yourself. So the question is, should we go ahead and induce you at 39 weeks to help prevent the things that were discussed before, or should we let you move towards the 40 weeks? Is that safe for mom? Is that safe for baby? So that's the question that we are looking at. When you did your study, would you say that there is a downside to going ahead and inducing at 39 weeks?
Our study would suggest that it's better to deliver at 39 weeks, and that the level of cervical ripeness, as you've described, doesn't matter. The C-section rate is actually lower even with, quote, unripe cervix compared to ripe cervices.